Good morning, Mrs. Smith. I'm going to just be emptying your drains today. I'm going to just take a quick peek at your armband here. Good. Okay, the first thing I'm going to do is wash my hands. And I'm just going to be looking at the two different drains that Mrs. Smith has. The first drain is a hemovac. They also sometimes call it a pancake. I'm going to just put on my gloves here. Okay, and typically this is attached to their gown, so I'm going to undo that. I would want to make sure that I have a chucks in place because, again, anytime we spill, we certainly do not want to do a whole bed change. And the other thing we're going to do is we're going to grab a graduate pitcher, and it's a little bit larger because a hemovac actually holds a total of 400 milliliters of fluid. So again, it's a little bit larger reservoir, and so we want to make sure that we're able to dump the whole thing into a graduate pitcher. When I open this up, you will see that the suction comes off and it actually opens up. What I'm going to do is I'm going to bring my container closer. I'm going to kind of pull that off to the side, keeping it as aseptic as I can. I'm going to be dumping out the solution or the secretions. I'm going to be looking at the color. I'm going to be looking at any type of odor that I might have, the consistency, if there's any blood clots in there, and I'm going to be looking at the amount. Okay, so I'm going to just set that more on a sturdy table. The last thing I'm going to do is I need to clean the areas. So the opening, I need to clean. I'm going to just clean the opening. And I'm going to clean the plug. Okay, and to reestablish the suction, I need to go ahead and push that down. And I put the plug back in the opening, and it should stay flat like that. If not, if it sucks back up and we lose suction, we want to make sure that we check all of the connections that there are. So again, that is emptying the hemovac. What we would do with our drainage is we would want to make sure that we note what we call the COCA, color, odor, consistency, and amount. And we would want to make sure that we document on the I&O that there's 100 milliliters and it's pretty sanguineous. So again, you would want to say if it's sanguineous, serosanguineous, serous. The other things that you would want to report to the physician if there's absence of drainage, there's purulent drainage in there, that would be something that you would want to notify the physician about as well. The last thing we want to do is make sure that we attach this back to the patient's gown. And again, because if they get up, we don't want anything to pull on that drain, so it would actually pull out. Okay, and that is the hemovac. The next one we're going to talk about, and I'm going to again just change my gloves. I'm going to wash my hands. I'm going to put on new gloves. I'm going to just undo this because I know her JP is underneath here. And again, this is called a Jackson Pratt. They sometimes call it a grenade or a bulb suction as well, they call it. And again, they typically have this attached with a safety pin to the patient's gown so that when they get up, it doesn't apply any pressure to the area that it's coming out of. So I'm going to unpin that. I'm going to make sure I have my container, and again, this one holds only 100 milliliters or 100 cc's, 100 milliliters of fluid, so we don't need a very big container. So typically they use a urine specimen cup, and what we're going to do is we're going to just put the cover up. Okay, and we're going to put that on a solid surface again on top of a chucks pad. When you open this up again, it will lose its suction, and it will actually look just like that. We're going to kind of pull that off to the side, and we're going to kind of squeeze this together as we try to empty that. Noting again the COCA, color, odor, consistency, and amount. And again, this is very sanguineous. So we'll measure that later. The next thing we want to do is we want to alcohol off the areas. We're going to alcohol off the opening. Then we're going to alcohol off the plug. And we're going to reestablish suction. And in order to reestablish suction, you want to squeeze it together as firm as you can. Put your plug back in the hole and let it go, and it should then look like the suction is being held in there. What you want to do next is you want to pin it back to the patient gown, again, so that it doesn't pull out when they get up. And same with this one. We'll get rid of our alcohol. We would notify the physician if there's absence of drainage, if there's any purulent drainage, any signs and symptoms of infection. We would want to let the doctor know. We are going to get rid of our solution now, or our excretions, I should say. And this is a total of 50 milliliters of sanguineous drainage. Again, most facilities dump it in the toilet in the bathroom. And once you've dumped it in the toilet, be careful that it doesn't splash back up in your face. If you feel as though it's going to splash back up in your face, you would want to put on the appropriate PPE. Then you would rinse out your containers, and you can reuse these containers. And that's how you empty your drains.